it felt like somebody walked up beside me and put one hand on my chest and one on my back and just started squeezing. And my hands started to clench, and that's when I knew I needed to go to the hospital.
It was like watching a ballet of these professionals.
And if she hadn't had this heart attack in the hospital where she did, she may not have survived.
I'm a general cardiologist with a special interest in heart failure.
Hi, I'm Karla and I am a heart survivor. Just a normal day on September 29th, 2017. Got up, was getting ready for my day, got in the shower, just wasn't feeling good when I got out. Nothing discernible as to what it was. So I sat down on the bed, kind of relaxed a little bit, and it went away.
She knew it wasn't normal. She tried to lie down for 15, 20 minutes. It didn't go away. Then she asked her significant other to bring her to the hospital.
Okay, my significant other, Art, assisted me into the vehicle and drove me to the hospital.
Art and Karla pulled up in front in their car, and of course, as the valet service usually does, we go to the car and ask them right away, can we park your car? Is there anything we can do for you? And Art immediately told me that Karla was having some kind of a problem. And so we knew right away that she needed to get into a wheelchair and go to the ED immediately.
And they got me into the wheelchair. We came through the lobby, past the front desk, and I went into cardiac arrest, and there's nothing there after that.
So when we got Karla in the wheelchair and I started to take her back to the elevators so we could go on to the emergency department, I noticed that she started to really stiffen up, and she got to where I could tell she was in trouble. So when we got back by the elevators, I gently got her down on the floor because she was sliding out of her chair anyway at that point, and the rapid response team was called.
As I was arriving at the area of the Code Blue, I noticed that Jerry, the valet, was running to get the AED. I got to Karla's side and we assessed her. She was unresponsive and was not breathing and no pulse.
Miss Sainer was having a heart attack, and she had an arrhythmia called ventricular fibrillation. Ventricular fibrillation is a very serious rhythm where the patient has no pulse or blood pressure, and that's why she collapsed.
So I ran back to the valet station where we have one, and I ran back with it and gave it to them, and they proceeded to save Karla's life.
Jerry handed me the AED, and I opened it up. I put the patches on Karla, and it analyzed her rhythm. It showed that she was in a rhythm that we needed to shock. I cleared everybody off of her, and we shocked her. Once we shocked Karla and she returned to a normal sinus rhythm with a pulse, we transferred her to the emergency department where she had further evaluation.
The next thing I remember is just a brief flash, I assume was in the ED. People standing over me, doing a chest rub and calling my name, and I went back out. And after that, it was waking up in my hospital bed in the cardiac ICU.
Dr. Tuma was our cath lab physician that day, and he was contacted, and Ms. Sainer was moved from the ER over to the cath lab for an emergency angiogram. That's a dye test to look at the heart vessels, and it was found that the LAD artery, which runs down the front of our hearts, was totally blocked. Dr. Tuma was able to quickly open her LAD artery with a balloon and a stent. Ms. Sainer was transferred from the cath lab to the CCU on the 5th floor to begin her recovery. And that's when I began taking care of her.
I got told what was going on and what had happened to me, and I thought they were joking because I didn't know anything was wrong to start with.
Ms. Sainer woke up very quickly and was able to come off the respirator within a matter of hours of going to the CCU from the cath lab. And she could not recollect the events over the prior few hours, but otherwise she was completely intact and seemed herself just a little dazed.
When I woke up in the hospital room, I was informed that I had had a cardiac event due to a heart attack. They told me I had received a stent due to a 100% blockage in the main artery of my heart. I had no idea. I thought they were joking, as I didn't have any history of heart disease in my family. I was a healthy individual. Had no idea anything like this could happen.
Ms. Sainer remained in the hospital 3 more days and recovered very nicely, no complications from her heart attack. She suffered minimal heart damage because she followed her instincts and went to the hospital immediately, and then received very quick, prompt treatment. Everybody did a fantastic job. Everything went very well. Everything happened as it should.
It was wicked.
Okay, so if you want to know the truth, this changed my life almost as much as it changed Karla's, because it really meant a lot to me to see how these people can do their job and save somebody's life. And it was wonderful to be a part of it.
I've seen her in the office a few times and helped her with some of her heart risk factors, such as having her quit smoking, and encourage her to continue on in cardiac rehab, which she has attended. She's been in our Phase 2 program and is now graduated into the Phase 3 program.
Since my event, I have completed Phase 1 and 2, and I'm currently enrolled in Phase 3 of cardiac rehab. I go faithfully. I have quit smoking, which was my main risk factor, and just try to lead a better lifestyle. And I listen to what my body tells me, because you never know, anxiety can be a heart attack.
We've been working with Ms. Sainer on leading a healthier lifestyle since she had her heart attack. The acute treatment happens very quickly. What's very important is how the patient does in taking care of the risk factors after the heart attack happens. Basically, we have the patients go to cardiac rehab so they learn good lifestyle habits. They receive a lot of teaching on their diet. They begin to learn about the importance of exercise.
I first came into contact with Karla when she volunteered for one of our clinical research programs. It's the kind of programs that the American Heart Association promotes. It's the kind of programs that in the long run prevent the kind of issues that Karla went through. And the program that Karla signed up to help us with is one that addresses cholesterol and the issues that we face.
The key to Karla's survival was early interventions of CPR and the use of an AED for a shockable rhythm. If it wouldn't have been for these, Karla would not have survived.
If you have symptoms you think may be related to a heart attack, don't ignore them. Pay attention. Not everybody's symptoms are the same. There's often a big difference between symptoms in men compared to women. See your doctor. If you have discomfort in the chest, back, neck, jaw, down the arms that is unrelenting, you should call 911 and go to the nearest hospital.
It's only through the volunteer activities of people like Karla that we can move the science of cardiovascular disease forward and hopefully in the future prevent things like this from happening to other people.
If you don't know how to do CPR or use an AED, what are you waiting for? Now is the time.
I would like to extend a heartfelt thank you to everyone involved, from the valets to the nurses to the physicians, and to the American Heart Association and the research that they do. Without them, I would not be here today. And this is why.